we've got another question from a caller. Her name is Patty, and Patty, you are live with Docs on Call. What's your question?
Yes, I recently had a DNC and was told that eventually I will have to have a total hysterectomy, and because my cervix is too small, they will have to do an incision. So would this robotic be a procedure I can use?
Well, normally, again, people who I consider good candidates for robotic hysterectomy are people who've never had children where maybe the vagina hasn't been stretched. And so, yes, that would be a good candidate for it. Or people who've had multiple C-sections where it's hard to peel the bladder up off the lower part of the uterus. Those are the people who are great candidates for a robotic hysterectomy. What do you think, Dr. Boyd?
I agree. I think this would be a good candidate for this procedure.
Okay, and it sounded like Patty was maybe concerned that she or the person that she was speaking of would not be a good candidate, but you say it sounds like potentially they could be a very good candidate.
I just want to mention on that note, there's very few patients, and I don't want to say 100%, but most patients, and I would say it's probably 90%, would qualify for robotic hysterectomy.
Oh, wow.
And you had commented on that. Who is the person that wouldn't be a candidate? I think somebody with an extremely large uterus that you can't see around the uterus with the camera is somebody that you would consider maybe to open. But you know, whenever you're weighing a regular conventional laparoscopic hysterectomy versus the robotic one, we're seeing bigger uteruses removed robotically. And so I think as experience grows, that's going to be kind of a relative contraindication.
Proving that it really can be done in almost any circumstance.
Yes.
Almost. All right. I believe Becky is our next caller on the air. Becky, you are live with Docs on Call. What's your question?
Yes, I heard you talk about the robotics and also the open hysterectomy. I'm wondering about the vaginal hysterectomy.
What in particular are you wondering about? If it's
well,
still
if they
commonly
would still
used?
do them, or if the machine would take the place of doing a vaginal.
You think it will?
Well, our college currently is recommending that if you can do it vaginally, where there's no incisions at all, you probably should go that route. But when you can't do it vaginally, then you probably need to do it laparoscopically. And so, like I said, robotic hysterectomy just offers another option. What the robotic hysterectomy is there to replace are the ones that we would normally open. You had mentioned there are, 600,000 hysterectomies done here in the United States. 90% of them are for benign reasons. And of those 90%, 2/3 of those are still done by an open technique. And so really those are the ones that the Da Vinci is targeting to decrease the amount. We're not really competing against the vaginal hysterectomy. We're competing against the open abdominal hysterectomies.
Okay.
I agree. And the only other comment I would make to this lady is from the trying to remove an ovary vaginally sometimes is very difficult, and the robotic approach would allow that to occur, whereas vaginally it's more difficult.
All right. So robotics with more ease.
Yes.
Okay. Now, robotic hysterectomy, now performed at Methodist Medical Center, is a minimally invasive advanced laparoscopic surgery that uses state-of-the-art robot technology and magnified 3D vision. Pretty amazing stuff. We're answering your questions tonight about this advancement in women's health. Call 698-3742 to talk to our experts, Drs. Marc Boyd and Tracy Bochantin, or log on for an online chat with Dr. David Kindred. And speaking of Dr. Kindred, let's head over there now and see what kind of questions you're getting there. Dr. Kindred, what are folks saying to you online?
Well, a lot of the questions include what are the benefits of robotic hysterectomy, what are other options. You mentioned fibroid tumors earlier, which are a common complaint in our field of medicine. I think robotic hysterectomy has a lot of advantages. I know from a surgical standpoint, I've enjoyed doing the surgery, and I know from my patient standpoint, the benefit of faster recovery in regards to return to work, return to family care at home has been a huge benefit.
Do you find that you're having to maybe talk to people online, maybe kind of calming some of their fears? Because to some folks, this may seem like a almost riskier prospect, because a machine going in there to do these fine surgical procedures might seem a little scary.
Well, Gina, that actually hasn't come up yet, but I'm
well,
sure
good.
that's about to happen.
Well, I hope I haven't put that in anyone's mind. Actually, all of you are making the point that indeed this may be a much safer way to go. And as we mentioned, boy, time back to work and with your family and doing those things that you love to do, you know, that's what it's all about. And the cost savings, I'm sure that's an extra added benefit. Because certainly with less time in the hospital, not only is it less expenses on the healthcare system, but you as the patient indeed can really benefit from that. Let's get to another caller. Tracy is on the line now. Tracy, you are live with Docs on Call. What's your question?
Yes, thank you for taking my phone call. I have a question regarding peri-ovarian cysts. I had to have one removed in 2008, and I was told actually it was the size of a softball. I just wondered what causes those?
What can be the different causes of the cyst, particularly one that big?
Well, I think that if it's a para-ovarian cyst, we call those cystomorgagni.
Which means?
What those are is when we're developing inside, we have both male parts and female parts. The male parts and the female kind of shrivel up and go away. This is a remnant of those. And yeah, I have seen them get fairly large. They're actually separate from the ovary. But we don't know that when we're doing the ultrasound. All we do is we see a dark circle around the ovary. And when we go in to remove them laparoscopically, we see that they have nothing to do with the ovary. They're coming off a tube. And so we just go ahead and we remove those. And so, yes, this would be a very simple case that we could do with the Da Vinci robot.
And you might find when you get in there that that's really all you need to remove.
Right.
Is that right? I mean, you could check out everything else and it looks good.
Yes.
All right. Well, that would actually offer some comfort, I hope. We've got a call now from Jessie. You are live with Docs on Call. What's your question?
Hi, thanks for taking my call. I've got a question in regards to, since it's such a new procedure, what is the certification or training curve that the doctors go through for the use of the Da Vinci robotic machine?
Yeah, fair question. People want to know that you know what you're doing on this kind of equipment.
Absolutely. It's a great question. And the robotic surgery does have a steep learning curve, and hospitals are looking out for patients. You have to go through a fairly extensive training process. We went, actually both Dr. Bochantin and myself and Dr. Kindred, we went out of town and did surgery on pigs, actually. And pigs have similar anatomy as women do, and we hooked the robot up to the pig and did surgery on the pig. Then when we arrived back in whatever community we're in, obviously here in Peoria, we were staffed by physicians that had done robotic training prior to today, or the day that we're training in. And we had to do so many procedures with that robotic surgeon. It's interesting, the robot has been around for a number of years. It was actually developed by the Army to do surgery from far away. In other words, if there was a soldier on the battlefield in Iraq and a surgeon in Germany could do the surgery. And so it was kind of a neat process where the surgeon did not have to be there.
Now, in this case, we're not talking about that kind of situation where you're in a different room. The equipment's actually in the same room. You're just feet away from the patient.
Yes.
About how many of these procedures have been performed here locally so far? Do you know?
Hysterectomies, I'm not quite sure how many. I'm approaching 65, and I don't know how many.
I've done 35.
With the robotics?
With the robot.
Okay.
Mm-hmm.
That's a pretty high number.
Mm-hmm.
And again, hopefully giving people comfort, because that's what they look for in these kinds of situations too. All right, we've got a question now. We've got a caller waiting. Arliss, you are live with Docs on Call. What is your question?
Hi, and thank you for taking my call. I know that reading in like Time magazine or listening to 60 Minutes, they say that a lot of hysterectomies were given that were not necessary.
How would the two of you respond to that? And is that a problem that we are continuing to see? Is that a problem in the past? Was it a problem at all?
I think part of it is a problem because a lot of the reasons that we're doing hysterectomies are because of perimenopausal complaints where there's a hormonal imbalance. And so if patients are willing to work on fixing that hormonal imbalance, they don't necessarily need a hysterectomy. The problem is with time, patients either don't want to take a pill their entire life. They don't want to work on the conservative method. They've been bleeding for this many years and they want to be done. But I have to agree, a good portion of them really are hormonal imbalances and can be fixed conservatively if the patient is willing.
I agree.
Okay, let's go to Tracy now. Tracy's live with Docs on Call. What's your question?
Hi. I just would like to say that I had a procedure with the robotic arm, with Dr. Boyd, and I recovered in about 2 weeks. And I would highly recommend the procedure to anyone that needs it.
All right. Well, there you've got a fan, Dr. Boyd.
Well, thank you very much.
That? Oh, Tracy, thanks for calling in. Very good. Julie had this question. Why do you remove the cervix when it is normal during a hysterectomy? Is that something that you would do?
Well, there's two thought processes on this, and physicians, surgeons have different opinions on this. I'm more of a pro. I recommend leaving the cervix for most patients. If it's a benign cervix, you know, it's interesting, the history of hysterectomy, after Dr. Papanicolaou came out with the pap smear in the 50s, it was recommended that women, when they had their hysterectomies, that the cervix be removed. The problem with removing the cervix is it increases the risk for prolapse. That means that the organs fall. And so I believe if it's benign that we should leave the cervix. Not every one of my colleagues believes that, and I'm not saying I'm right, it's just a different thought process.
You need to talk to your doctor overall, share your concerns with them, and make the decision that's best for you.
Correct.
All right. You know what? We are just about out of time. The time flies by, and we appreciate all of you who called in and logged on with your questions. Continue to log on if you didn't get your question answered. We'll be here for a little bit answering those questions, and we hope to see you back here again next month with more of Docs on Call. I'm Gina Morse. Good night.